Thank you very much for coming along to support my Target Ovarian Cancer event. And thank you to everyone who knows me well enough to know that making cakes isn't my forte and stepped in to avoid embarrassment. There are over 200 different types of cancer. The unfortunately common ones have their own month for awareness and fundraising, and in March it's the turn of ovarian cancer. This is of particular interest to me as in January 2013, a routine investigation into a niggly woman's problem started me off on my cancer journey of 2 operations, 6 months of weekly chemotherapy, hair loss, and now maintenance treatment, which is ongoing. When I was looking at the various ovarian cancer charities to see what I could do in March, I really liked Target Ovarian Cancer's challenge. This is to tell 50 women about the symptoms of this dreadful disease in an attempt to help early diagnosis, because on average 1 in 50 women will develop ovarian cancer in their lifetime. Plus it didn't involve running 10k or cycling 300 miles. Ovarian cancer is often referred to as the silent killer and is the 5th most common cancer among women in the UK. 4 ovarian cancer charities are working together during March to change the perception that ovarian cancer can't be detected until the latter stages and to stop the term silent killer being used by improving awareness in both women and GPs of the common symptoms. Around 7,000 women are diagnosed with ovarian cancer each year, and sadly 4,300 women lose their lives each year. With only 3% of women in the UK very confident in spotting a symptom of ovarian cancer, and almost a third of women facing delays of 6 months or more in getting a correct diagnosis from first visiting their GP, it is perhaps not surprising that survival rates in the UK are amongst the lowest in Europe. I want to do all I can to alert as many women as I can of the most common symptoms and encourage everyone to make sure their friends and family are also aware. One key factor in survival rates of ovarian cancer is early diagnosis. 3 times as many women would survive if their disease was caught at the earliest stage, stage 1. The common symptoms of ovarian cancer can be a bit embarrassing. It's not the sort of thing we discuss with friends over a coffee. They can also be misdiagnosed as irritable bowel syndrome or the result of being overweight and can go hidden for years. Patients can often feel frustrated by lack of support from their GP. It took me 4 appointments in 4 months to get referred. If I hadn't persisted, or if I'd accepted a nurse's advice that it was just something I had to live with, my story would have had a very different outcome. In fact, by the time of my hysterectomy, I had cancer in my fallopian tube which had quickly spread to my ovaries and beyond. It was classified as stage 3C. Target Ovarian Cancer provides an online training tool for GPs to enable them to continually refresh their knowledge on the symptoms of ovarian cancer with the aim of improving early diagnosis for women. As of the end of February, over 10,000 GPs have completed this online resource, which means more women will be referred earlier for further investigation. Up-to-date, medically approved information on the common symptoms can be found on the leaflets available here, so make sure you take one home. If you or anyone you know is experiencing symptoms outlined on the leaflet, I urge you to keep a symptom diary. There is an online resource available too. If your symptoms are frequent and persistent, talk to your GP and take your symptom diary with you. One thing to remember is that cancer doesn't just go away. So if your symptoms are frequent and persistent, it is important that you see your GP. There is a simple blood test that can be an indicator. It's called the CA125, and a normal reading is anywhere between 0 and 35. Unfortunately, it can't be used as a marker for routine screening for ovarian cancer, as the reading can be affected by other factors or problems which are not cancer related. I personally know of 2 people who had a very high CA125 result and no cancer, so the test cannot reliably be used in every circumstance. However, being aware of its existence could help you discuss with your GP any further investigations that might be appropriate. Despite many ongoing clinical trials, there have been no new life-extending treatments in over 20 years for ovarian cancer. If we were able to achieve for ovarian cancer what has been achieved for breast cancer in the last 20 years, over 3,000 women would survive each year. Saying that, it's certainly not all doom and gloom. The current treatment available is surgery and chemotherapy, which is tough, but it does work. There are many clinical trials going on, and Target Ovarian Cancer have just won an award for their Clinical Trial Information Centre, where patients can find out what trials are taking place in their area. I take great comfort in the advances in medicine that are going on all the time, but more work is desperately needed in this area. With a particularly high rate of recurrence, Target Ovarian Cancer also provides support for ovarian cancer sufferers at all stages. Thank you for listening, and please help me to spread the word so that ovarian cancer can't be called the silent killer anymore.